Successful Breastfeeding, a beginner's guide to getting started. Hello and welcome to Videojug. This guide is suitable for mothers with newborns who want to get started with breastfeeding. It has been prepared following government guidelines and advice from experienced midwives. Remember, breastfeeding isn't for everyone, so don't be surprised if you have trouble with it. For more information about common problems, watch Videojug's Successful Breastfeeding, Regular Routines and Common Problems. And don't hesitate to contact your local clinic or health visitor if you have any concerns. Once you've decided to try breastfeeding, the biggest challenge is getting started. You'll usually be encouraged to try feeding almost as soon as you've given birth. It's good for the bonding between mother and child and for the baby's feeding instincts to put her to your breast. As soon as they're born, babies have a rooting reflex. This means that when you lie them on your chest, they'll try to find your nipple with their open mouths. Most importantly, your newborn baby finds this initial skin-on-skin contact with her mother enormously comforting. It takes a couple of days after giving birth for normal milk to be produced. Immediately after birth, your breasts produce colostrum, a rich, creamy kind of milk containing antibodies to help your baby fight infections. Even if you decide not to carry on with breastfeeding, giving your baby colostrum is a great start. When your normal milk comes in, your breasts feel fuller and harder. It's common to feel quite emotional at this time. It's known as the baby blues. This tearful phase is not postnatal depression and should ease off after a couple of days. Step 1. Getting started. Avoid having to interrupt a feed by having everything to hand before you begin. Choose a peaceful place to sit where you and the baby can feel relaxed. If you have an older child, it helps to make sure they feel included and have something to occupy them, so sit them near you with something to play with. Sit upright. Make yourself comfortable with support for the neck and maybe a cushion on your knee to support your arm and the baby. Step 2. Latching on. Latching on is when the baby takes the nipple in her mouth and starts sucking. To begin with, you'll have to help her. Hold your baby in the crook of your arm in an almost lying down position with her cheek near to your breast. With your free hand, gently but firmly squeeze your nipple around the areola area and direct it into the baby's mouth. Imagine you're making the tip of your breast into the shape of the end of a flat, oval ice lolly. Remember that the baby has to take the whole of the area, including the areola, into her mouth, not just the nipple. Gently but firmly push the end of the breast, including the areola, into the baby's mouth. Her natural sucking reflex should help her start to feed. If you don't succeed, try again. But relax, take your time, and soothe your baby if she's frustrated. If you get wound up, it will make it harder for the milk to flow. Step 3. Completing a feed. Continue to hold your breast and nipple in the baby's mouth, especially if your breasts feel hard and full, as the baby may find it hard to maintain contact. After some minutes, your baby might stop feeding. Gently lift her upright, hold her so her face is resting on your shoulder, and rub her back, as she may need to burp. Try to feed once more. If your baby's had enough, she won't latch on. If she's hungry, she will root for your nipple. Remember to take your time. A good feed can take up to an hour. During the feed, the milk changes in quality. In the first few minutes, the breast produces foremilk, which is watery and will quench the baby's thirst. After this, the baby gets to the hind milk, which is rich in calories. It's important to let the baby have at least 15 minutes on each breast before changing to the other, so she gets both kinds of milk. Step 4. Finishing the feed. Babies, especially newborns, fall asleep when they've had enough. They normally fall asleep at the breast, their mouth open. Sometimes the baby will fall asleep but suck intermittently for comfort. Don't let the baby do this for more than a minute, or you may end up with sore nipples. Step 5. Taking the baby off the breast. If the baby is still latched on, slide your finger between your nipple and her mouth to ease suction. If you just pull your baby off the breast, it will hurt. It's normal to have sore nipples to begin with, especially if your baby feeds a lot in one day during a growth spurt. Step 6. Looking after yourself. Mothers need on average 500 extra calories a day, so eat if you're hungry or have cravings for sweet things. However, try to keep to a healthy, balanced diet and make sure you eat plenty of protein. You'll need to drink more water than usual, especially during hot weather. To have a good supply of milk, don't overdo it. Try to sit down and get some rest throughout the day. Step 7. Remember. Currently, most health experts are pro-breastfeeding, but overall, most people acknowledge that a happy mother equals a happy baby. Breastfeeding doesn't work out for everybody for a variety of reasons. Don't feel guilty if you can't do it or you need to supplement with bottles. See the second part of our breastfeeding film for tips on establishing feeding for your growing baby and solutions to feeding problems. Good luck!